Chapter 2. The 5 Stages of Parkinson's Disease. First stage. This is just the beginning and the mildest form of Parkinson's. At this point, a person with the disease may have hardly any symptoms, and if they do have some symptoms, these do not interfere with their daily activities. At this stage, if any symptoms progress, they might even be missed. Any tremors and difficulties with movement are on only one side of the body, and medication can easily alleviate the symptoms. Second stage. This is looked upon as the disease being in the moderate form. The symptoms are much more noticeable than they were in the first stage. People begin to be aware of stiffness, tremors, and trembling. Even different facial expressions that were not there before can occur. While at this stage balance is not impaired, there can be muscle stiffness which can make it difficult to do daily chores. Each individual progression is different. Symptoms can be felt on both sides of the body, and speech difficulties can begin. Third stage. This stage is known as the mid-stage of Parkinson's, and it is the beginning of a major turning point in the progression of this disease. A great deal of the symptoms are the same as they were in the second stage. The difference at this stage is that now there can be loss of balance and reflexes can decrease. It is important to be careful because falls can occur. Daily tasks are affected, but with perseverance, patients can complete them. These symptoms can be decreased by a combination of medication and occupational therapy. Fourth stage. It is still possible to stand without assistance, but regular movement might require the use of a walker or other kind of assistive device. If a person at this stage is living alone, they require a daily caregiver, since there is a significant decrease in movement and reaction. As time goes on, it is almost impossible to carry out daily tasks, and living alone can become dangerous. Fifth stage. This is the most advanced and debilitating stage of Parkinson's. There is an advanced stiffness in the legs, and they can become immobile upon standing. Patients need wheelchairs, and often they're not able to stand without falling. Now, around-the-clock assistance is needed so that the patient does not fall. There may be hallucinations, and people can become delusional. At this point, the side effects of medication can far outweigh the benefits. Even though there is no cure for Parkinson's, people are urged to understand the symptoms, and as with any disease, early detection can improve their quality of life. It is suggested that this disease might be genetic, and the men are at a higher risk in getting this disease. It can greatly help to know your own risk factor and help detect the symptoms in the earliest stages. All people are not the same and go through the stages of Parkinson's differently. One important thing to always keep in your mind is that this disease is not considered to be fatal.